thank you. I have Dr. Ben. So hi everyone. My name is Roca Cruz and you're in Be.Live. Be yourself and live your purpose. Today we're talking about something many women quietly struggle, and that's aging or menopause. A lot of women gain weight, they can't sleep, they're moody, and it's always, the excuse is, tumatanda na ako or matanda na ako o ganon. But what if it's your body asking for balance? My guest today, he has helped a lot of women feel alive again.
In more ways than one.
Dr. Ben Valdecañas. He's a specialist in regenerative medicine, and he's a sports doctor and an orthopedic surgeon. So Dr. Ben, thank you for being here. Can you share your specialty? What led you to regenerative medicine?
Okay. I'm basically an orthopedic surgeon by training, but I subspecialize in sports medicine. So it's a subspecialty of orthopedics and other specialties. Now, as a sports medicine specialist, not a lot of my patients are really sick. They come to me wanting to enhance their performance, maybe top up their functionality, get more energy, perform better. Not only at work, but also in sports, since a lot of them are weekend athletes. Now, also there's management of sports injuries. That's where I do my surgeries. So ACL reconstructions, joint replacements, that sort.
So wait, Dr. Ben, what's your CV? Where'd you study? Alam ko, you studied in UP.
That's my pre-med. Hence the UP Divers thing.
That's why I know him.
And then I took my medicine in UERM, and then my orthopedic surgery and general surgery training in St. Luke's Medical Center. QC pa lang noon, wala pang BGC.
Wala pa.
So after that, I subspecialized in sports medicine in San Antonio, Texas. And then since my parents were immigrants, I had to stay there for a lot of times. So I took certain courses, and one of them was anti-aging medicine under A4M.
Okay.
That's where I got trained with hormone replacement therapy.
Did you live there and work there?
I had a chance to work there for a while, but I really wanted to come back to the Philippines and be of service to our fellow men rather than to other people.
Oo nga, we need doctors that are so open, that are forward thinkers. So, okay, ito na yun. This is what we're gonna talk about. Menopause. So what happens to women's body during perimenopause? That's like 30s yata, you start the perimenopause.
40s, yeah.
Okay. Menopause and post-menopause.
Okay. People say that our hormones decline when we age, when it's the other way around. We age because our hormones decline.
Ah.
Yes. So
Okay.
menopause is that phase of a woman's life wherein her hormones stop producing, particularly your sex hormones, estrogen, progesterone,
Okay.
and then secondarily your testosterone as well. So the same with men, but we'll talk about that later. Okay? So when a woman enters menopause, usually that's at age 55. They say 10 years before that and 10 years after is the perimenopausal period. So you experience the symptoms of hot flashes, mood swings.
Mood swings.
Although the mood swings, our partner or those people around us are the ones who notice it more than we do.
Or the children, or the
children,
yayas.
Yeah. So these symptoms are telltale signs that you are approaching menopause. And then we diagnose menopause when you have 1 year period that you did not menstruate.
Okay, so that's menopause na.
That's menopause.
You must, like this month I didn't get, pero the next month I had, that's peri.
That's still perimenopausal,
okay.
yes. And then once you reach that 1 year without menstruating, then you are officially menopausal.
Okay.
So that means your ovaries stop producing estrogen, progesterone, and then the secondary changes.
Do you stop having hot flashes pag you're already menopause? You stop.
Eventually, yes, because these symptoms are caused by the change or the shift in hormones. So the shift is sudden for women. So menopause happens suddenly when your ovaries suddenly shut down or stop producing hormones.
Okay.
So the hormone change is abrupt. So the adjustment of the body with this abrupt change in hormones is what causes those symptoms. The irritability, the hot flashes, the lack of sleep even.
Oh, yeah, correct.
Yeah, difficulty in sleeping at least. And then the lack of energy suddenly, like for example, a day's chores, 2 p.m. pa lang, hindi mo na kaya tapusin when you can easily finish it at 5.
Or for a lot of women, the ones that work out and then you can't anymore lift.
Oh, that's what I usually get in my clinic. So people complain to me that it suddenly takes so long for them to recover from a day's workout. So instead of wanting to exercise daily, they now have to exercise every other day to allow their bodies to recover.
Pero that's normal. Every other day, you can't naman work out every day.
Actually, as a lifestyle medicine, coaching people who want to improve their lifestyle to avoid lifestyle diseases, I recommend daily exercise. So when I recommend regular exercise, the key word is regular.
Okay.
And I recommend being daily or doing it daily because we are creatures of habit. The more you do it, the more consistent you do it, the better the results, the faster the results. So you have to manage your exercise intensity so that you're not too tired to exercise the following morning.
Okay. Kasi, well, I graduated sports, physical ed. So I know it's like when I do my exercise, I do the upper body. If I do it every day, I split it. But if I do it twice a week, I do everything Tuesday and then the whole body on Saturday or Friday. That's okay. But walk every day. That's,
You have to have a certain exercise every day. And of course, you understand being of that background that every good exercise program has 3 components. Your
Okay.
stretching, your cardiovascular, and your resistance.
Okay.
So you can do all 3 in a 30 to 60 minute period, provided that it's not too intense as to tire you too much to exercise daily.
the next day. Okay.
An example would
Parang
be...
so hard, ano?
Not so hard.
Time.
Well, 30 minutes to an hour is fine, especially when you're you're in the climacteric phase of your life. You're menopausal.
Okay.
So you don't have to exercise intensely. So a good example of what I just mentioned would be 5 to 10 minutes stretching, cardiovascular, maybe stationary bike or treadmill, and then resistance, really just bodyweight exercises, push-ups, sit-ups, pull-ups, and a good exercise for those who are entering menopause actually is Pilates.
Oh, yeah,
Core
that's right.
strengthening.
Yeah. I want to do it. So hard lang for... My excuse is always I don't have time, but twice a week is better than no exercise.
Yeah, and there are programs, Pilates programs, floor routines that you can do in 15, 20 minutes. So that really cuts down and still manages to strengthen your core. Because that does you a lot, or does a lot for you when you're really into that phase already, the climacteric phase. A strong core also supports a good balance. And most of the people in that phase of
Correct.
life have balance
Poor.
challenges. Yeah.
I'm correcting my balance. Wait, so what are the early signs? I think we talked about of hormone imbalance. I know when I was younger, I had pimples. And then the dermatologist will give you hormones. But I didn't take the hormones. Parang it just gradually...
Dissipated,
Yeah, but I know they're saying that you get acne at a young age because of hormones. Imbalance. Now, when you're in perimenopause, the first thing, so that lang the women know that they're not going crazy. So what is the most common effect of starting with menopause?
Okay, like we mentioned earlier, it's the hormonal change that brings about all these symptoms.
Okay.
So yes, women are labeled crazy because of their mood swings.
Correct.
Bipolar even.
Oo.
So
tsaka
don't
ano,
listen to those labels, okay?
They don't understand what's happening.
They don't understand what's happening, and the people around them especially. So when you deal with hormonal changes, these, although they happen gradually, these are not avoidable.
Not avoidable.
These are not These are you can avoid these things.
Okay.
Sorry.
It is avoidable.
It is avoidable.
Okay.
Sorry about that. So, when you talk about hormonal changes, it is avoidable. The symptoms, at least. So, you see it on memes when we get hot flashes. You just stay in a well-cooled environment.
Like that's why pala most of the lolas are carrying pamaypays when you were young, di ba?
They call it abanico.
Oh, abanico. Yung pala hot flash na pala yun.
Yeah. So, but lolas are of course past that perimenopausal phase already.
The titas.
Yeah, the titas. The titas. So, stay in a cool environment. It's the irritability that gets fueled by these hot flashes. So, practice mindfulness, mental health. Yeah, these are all manageable.
Maybe if they know that they're going through menopause, maybe it will be manageable. Right?
Most women have an idea that they may be getting into the perimenopausal phase. But not a lot of women know that these hormonal imbalances or changes can be rectified medically.
Yeah, that's why we're here. We're
Yes.
gonna talk about that.
Yeah.
So, and also, wait, baka naman the listeners might think, okay, this will help me lose weight. This will help me sleep well. Or when I go to a party, they'll go, oh, you're so thin. I'm fat because I gave birth. That's why you can.
Okay,
That's why you're thin because you didn't give. Is that true or?
Well, actually, pregnancy, reproduction is the greatest equalizer of your hormones. So
Okay.
women who went through pregnancy, after they give birth, their hormones are rebalanced, like reset or rebooted if it were a computer.
Okay.
So it's these.
Parang nare-replenish yung
Yeah,
hormones.
it's a body's way of rebalancing your hormones. So that's why women who never got pregnant, they're more prone to cancer, they're more prone to early menopause, and stormy perimenopausal periods. So pregnancy is not a cause or a reason for you to gain weight. But of course, you gain weight because you feed for two.
Okay, but they're saying na well, syempre when they get married, they used to be sexy or thin, and then when they get older, they become bigger, and then they didn't naman change the food that they're eating. They exercise, they do everything, but they're still gaining weight.
Well, it's a matter of perspective because they gained weight when they were pregnant, taking care of a baby, because they needed to gain weight. But after giving birth, I mean, don't continue to eat as if you were pregnant.
So it's their fault ba rin?
It's always a food's fault. Okay, let's not call
Okay.
it their fault.
Okay,
It's
the
always the
food's fault.
Okay.
I was gonna say nga, baka they can excuse menopause. That's why they gain weight.
No.
Okay. So maybe people might.
So do something about it as the understanding increases on these metabolic changes and metabolic causes and effects. Then the more we can do about it and anticipate it to happen. So when you give birth, then go into a very strict exercise program, diet, that sort of thing. So do something about it.
Kasi most women gain weight dito sa belly area eh.
That's a function of estrogen.
That's estrogen naman. More estrogen or no estrogen?
Relatively more estrogen. That's
Kaya
why they're
belly weight.
increasing mid-belly fat.
Okay. So we'll talk about now the meat of our meeting. Talking to Dr. Ben, we'll talk about hormone replacement. What is that exactly? And what's the difference between the synthetic hormones before that you take, like if you don't want to get pregnant, that's a hormone.
Yes.
So they take the pill. Or they want to lose their acne, they take a pill. That's synthetic hormones. But you use
Identical. hormones,
bioidentical.
yeah.
What is that?
Well, these are also synthetic or synthesized in the laboratory or pharmacy. These are from plant amino acids to produce estrogen that is very identical to human estrogen or
okay.
human hormones. So we do progesterone, we do estrogen, we do testosterone, we even do thyroid
Estradiol.
hormones. Estradiol is one kind of estrogen.
Okay.
And it's the kind that we test because it's the most stable in the body. So when we do bioidentical hormone replacement therapy, we put together raw materials also to come up with a synthetic hormone.
But that's customized to per woman. It's not like the pill that they give and...
Well, yes, but the big difference, not just because they're customized to your lab results or to your current hormone levels, the big difference is oral hormones go through the liver.
Oh yeah, that's my next question.
Yeah.
I've tried to go to a lot of OB-GYNs and ask for hormone replacement, and they'll always say no, it causes cancer.
It increases the risk for cancer, yes.
Okay,
Yeah.
but is that...
Well, the reason it does is because when you take oral hormones, it goes through the liver as any food or medicine does, and it gets metabolized to something that's quite carcinogenic. So it has a different effect after going through the liver. Whereas bioidentical hormone replacement therapy, we use bioidentical hormones which are either applied topically or injected.
Okay.
So usually, estrogens and progesterones, even testosterone, are applied as creams, and testosterone replacement therapy is injected.
So there's no
Usually.
cream?
There is a cream, yes,
okay.
also. But unlike women, men are not very responsive to topical hormones.
Okay.
That's a big difference between men and women.
Kami, mahilig kami mag-ganan-ganan.
Well, not only the habit, but the physiology. Yeah. So bioidentical hormones are applied topically or injected, so they don't go through the liver.
Okay, so it's somewhat safer.
It's safer, yes. So it's safer, and bioidentical hormone replacement therapy or hormone replacement therapy is essential in managing menopause or aging. Because like I said earlier, we age because our hormones go down.
Okay.
Interestingly enough, our bodies are meant to live to 150.
Whoa.
Yes.
Di ba that's Bible time eh? Talaga?
Genetically speaking. So our genes are meant to last divisions of cells to
Pero
150.
I know in the olden times, so many people die because of plagues, because, they die at 40, at 30, di ba?
But biblical times, they live to, like Abraham lived to 800.
Oo
But
nga.
that's a shorter calendar.
May ganun pa.
May ganun pa. So he probably died almost 200.
Oh. Alam ko,
Yung olden biblical calendar is by harvest eh.
okay. That's
So
interesting.
it's about a fourth or a third of our present
Ang
year.
harvest yata yung harvest twice.
Twice or thrice. Or twice or four times in
Okay.
per season. Now, ang Gregorian calendar, which we use now, is a year because of the moon and it's astronomic.
Okay.
So it's the complete rotation of the Earth around the sun.
Ayan. So our hormones, if it's corrected or balanced, we can live until 150 years?
Well, not necessarily, because there are a lot of other factors in play or at play.
Okay.
So I was just about to say that our bodies were meant and designed to withstand repair and regeneration to 150 years. That's why we spoke about the Gregorian calendar. Okay, so genetically speaking, our bodies are meant to live to 150. But the current lifespan is just 75 for men, 78 for women. So it's practically
talaga?
half.
Is that all over the world or
It's
just
global.
the Philippines?
It's global statistics.
Sa Philippines, ano kaya? May statistics ka ba?
We're actually shorter.
Talaga? People die
By
at
disease,
60?
poverty, lifestyle.
Heart attacks. A lot of women now are getting heart attacks.
Well, just to give you an idea, we have a lot more patients now getting diagnosed with diabetes at the age of late 20s, early 30s. Heart attack, fatal, massive heart attacks, age 40s. So that's how much we are shortening our lifespan because of our lifestyle.
That's lifestyle. But with hormones, we can...
Okay, since we age, because our hormones go down, we can actually top up our existing hormones at this phase in our lives through bioidentical hormone replacement therapy. So we're sort of cheating nature.
Cheating.
Yeah.
Okay.
So we're prolonging our lives because we are healthier when our hormones are up there. We are healthier when our hormones are well balanced. So topping up your hormones gets you to a healthier state. Of course, all things held equal, like correcting your lifestyle, getting good rest, exercising, supplementing.
With vitamins.
Supplements, minerals. Yeah. Because not everything so the body heals itself, no, but not everything that the body needs to do so, we get from our food, especially nowadays. So we really need to supplement.
Okay, Doc. With your many years of practice, tell me a story of a person that you helped that changed. Naging better yon marriage nila because of hormone replacement, or even their skin, or
Well, I don't know about their marriage, but her life and lifestyle improved by leaps and bounds.
Okay.
I got this woman at the age of 50.
Okay, 50.
And she was diabetic. Okay? She was already on 5 oral hypoglycemics. That's 5 oral medicines for diabetes. Metformin, and all the newer ones.
Okay.
And she was already injecting with insulin.
Insulin, wow.
Yes. So she got diagnosed diabetic, type 2, type 2 diabetes, at the age of 25. So she's been diabetic for 25 years, and eventually, beginning 5 years ago, she was already given insulin.
Okay.
But all these 25 years, nobody talked to her about diet, exercise.
Nobody?
Yeah.
It's just, the doctors just gave her...
Medicines.
Okay.
Yeah. So her doctors just gave her medicines for the elevated blood sugar or the uncontrolled blood sugar. When you can control your blood sugar just by fixing your diet. So we started putting her on a very strict low carb, low simple carbohydrate diet. We shifted her from simple carbs to complex carbs, right? From rice, bread, and pasta to vegetables and fruits and root crops. And then we minimized it. We created a meal plan for her dependent on her or based on her basal metabolic rate.
Okay. No grapes, no durian, but with fruits.
With fruits, but grapes are not prohibited. Not
Really?
even durian. But she doesn't like durian.
Okay. It's sweet though, eh?
No, the thing is, the difference between simple carbs and complex carbs is that digesting and metabolizing simple carbs, there's a lot of carbs left residual. When you digest and metabolize complex carbs, you make use of a lot of energy that it burns itself.
So what's better, complex?
Complex, of course,
okay.
because you end up with less residual or excess carbs with complex carbs. Because what happens with excess carbs when you have a lot of simple carbs is that your body converts it to fat for storage.
And ergo the women with big
Not only that, maybe 80% of Filipinos now have fatty liver.
Because non-alcoholic fatty liver.
Yes, now we have an entity known as non-alcoholic fatty liver disease, or NAFLD, because in med school we were taught that alcohol causes fatty liver. So we tell a patient, oh, you have fatty liver, stop drinking alcohol, and the patient comes to us and says, I never touched alcohol. So it's the carbs in her diet or his diet that gave her or him the fatty liver.
So let's go back to your
Going back to my patient, the diabetic patient. So we put her on a strict diet, not only limiting her calories, caloric intake, but also we limited the macronutrient portion of carbohydrates. And within 1 month, we were able to get her blood sugar consistent.
Wow.
That her endocrinologist started pulling out insulin. So she discontinued insulin a month after the program, And she was left with her 5 oral hypoglycemics. And eventually, every second week, from then on, the endocrinologist would pull out or take out 1 oral hypoglycemic.
Okay.
And now she's only left with combination metformin and linagliptin. So,
But did she take hormone replacement?
yeah.
Okay.
Well, being 50, she was already in her perimenopausal, which she started having when she was 44. A chronic disease like diabetes can make you age faster.
Oh,
So when we tested her hormones, which is routine for us in the clinic, we request for hormonal levels. Her estrogen and progesterone were really rock bottom. So we started her on bioidentical hormone replacement therapy, and her metabolism from a BMR of 1.2, it went up to 1.5.
that's good.
That's good.
Okay.
So we were able to increase her metabolism beyond her or at par with her age, which was 50 at the time.
Okay. So now, how is she doing? She's taking hormone replacement.
She's on BHRT for estrogen, progesterone, and testosterone. So we customize her cream to contain 3 at a specific dosage that matches her needs. And then we put her on supplements, particularly minerals, which are important for sugar metabolism, like chromium.
Oh,
So
that's new. I don't know chromium.
it's not new. It's actually
okay.
physiology, which we have in first-year medicine.
Okay, but they don't. It's not in my vitamin list. Chromium.
Well, maybe you don't need it. You don't have any blood sugar challenges there. So she's doing well now with 1 combination medicine for her diabetes. In fact, I don't think she can be called diabetic anymore.
Wow.
Because her HbA1c has been normal for the past year.
Wow, that's a miracle.
Well, it's not a
Yeah.
miracle, it's just physiology.
I mean, for some people who are like going through diabetes, they think I'm diabetic forever.
That's the misconception. When a patient gets 2 misconceptions there. 1, both my parents are diabetic. I have no choice but to become a diabetic.
Okay, yeah. They're saying you're predisposition.
You're genetically
yeah.
predisposed to
Yeah.
diabetes. But the thing is, even if you have it in your genes from both sides, mother and father, if you fix your diet well enough, you will not get diabetes in your lifetime.
And that's diabetes is like inflammation na rin.
Diabetes causes a lot of inflammation, particularly in the kidneys. That's why even if you're on medication as a diabetic, you still end up with renal failure at the end of your life because you're lowering your blood sugar, but you still have diabetes going on in your cells.
Wow. But HRT won't help diabetes. It can
help balance your hormones because your hormones don't act individually. When your sex hormones, and mind you, we call them sex hormones because they change by gender, but they're actually not just responsible for sexual function, they're responsible for everything in the body. So if your sex hormones go down, all your other hormones go down with it. It's like a symphony, like an orchestra.
So it's just not one thing. So like if I'm going through menopause, it's my whole hormone.
It's your whole system. It's your whole hormonal system. It's your whole endocrine system.
And it happens because environment, like you said, we're built to last 150 years old. But because of environment, it gets younger and younger. People get menopause younger. Wait,
Correct. Yeah.
do men experience menopause? Because it's always women, menopause. I think it's called andropause.
Yes,
I
it
just
is.
don't want to alienate the men listening. And then what happens to the men's hormones and how does it affect their mood?
Okay. You're right, it's called andropause. And what most people don't know is that andropause can start at 30s, at a man's...
Younger than
At
women.
men's age 30, younger. Thing is, andropause happens so gradually that the change is not abrupt. Not like in women. That's why
Okay.
there are very telltale signs that tell you that you're menopausal. For men, I know men who have started andropausing at the age of 28. So signs would be increased formation or conversion of testosterone to dihydrotestosterone. That's the kind of testosterone that you find under your skin.
Okay.
And if you have a lot of that, particularly in your scalp, your hair starts losing.
Okay.
Yes. Okay.
You didn't take your BHRT.
Oh, but this is by choice.
Okay.
When my hair started receding, I shaved it all off.
Okay.
Anyway, so andropause happens so gradually that most people don't notice it. Most men don't notice it. It's actually the wives who notice it because symptoms are the same. The irritability, mood swings.
How about buying a sports car at age 50?
I was about to say
That's
midlife
hard.
crisis. Yeah.
That's hormonal.
Yes.
Looking for a younger wife, that's hormonal.
Cultural and hormonal.
Diba? Can be, no? Kasi you're
Well,
not...
it's driven by hormonal changes, but of course, culture, morality, ethics, has a lot to do with it.
But maybe the idea. But, so they get moody. So, what if they're together, they're having their menopause and andropause, and they don't know what's happening to their... So that's... You can be a marriage counselor, science-wise, di ba?
Well, I usually am when a couple consults me together. I educate them on what's happening with their moods, with their energy levels, with their libido even. That they start understanding what's happening and they become more tolerant, more understanding. So,
But if the couple takes BHRT or hormonal replacement, does it like
it helps.
an answer to their...
Well, not only, like I said, there's a lot of factors going on. So lifestyle, of course, there's the barkada of the man and the woman, so the buyo and stuff. The thing is, if you are to treat it and look at it scientifically, there's always a remedy. There's always a solution to this problem that they're going through in this phase of their lives and their marriage.
Correct.
So, as a marriage counselor,
Doctor marriage counselor.
okay, or as a couples counselor, you get them to understand what's going on. And the immediate effect is one, they become more tolerant. They become more understanding of each other. Second,
They don't get mad right away or
they don't
triggers.
lose patience. That's one thing that I've noticed with my couples. Second, when we put them on BHRT, a lot of these symptoms, they sort of lose their edge. So they become softer, more acceptable.
Like before. So they'll say, oh honey, you're the same as before we met. Ganon.
Something like that, yes. Well, it does help. So BHRT helps not only with the person's physiology, but also in their interpersonal relationships.
And I guess their sex life.
And their libido, of course. That's part of the interpersonal relationship.
For someone listening who feels off, either they're going through andropause, perimenopause, or post-menopause, Doc, what's the first step that they should do? Should they get their laboratory work done first, or they look for a doctor like you? I don't think there are many doctors like you, but later we're gonna ask Doc where to find him, but what's the first step? I'm getting crazy, Doc. I'm in my 49.
You're not getting crazy. You were labeled crazy.
Oo nga. I'm
Okay.
being labeled crazy. I think I'm going through menopause. Doc, what am I supposed to do first?
Okay, like anything in medicine, you cannot just apply a solution or a medicine or a treatment without having a diagnosis.
Okay.
So first, we do diagnostics. And in our clinic, we were able to minimize these tests to blood testing. And we ask for the usual blood count, chems, and hormones. And then since this is also the stage in my patients' lives wherein cancer is of much concern,
Okay, yes.
I also recommend tumor markers or cancer screening tests.
Okay.
So these are the first steps that usually we request of a patient. Now, once the results come out, we don't just look at them if they are within the range. In fact, the laboratory range is the last thing that we consider. We consider all the results in relation to each other. So the blood count in relation to the blood chem, in relation to the hormones. And then we also treat those results in relation to the patient's clinical symptoms.
So they call you first.
Yes, they can schedule a lab test. Yeah, which is like what I usually do with my patients. If they call me, message me, and then they tell me that their concern is this and that, I tell them, okay, do you have a recent blood test done? And then usually I accept a lab test that was done within 6 months. And then most of these tests, since they're the annual executive checkup kind of thing, they don't have hormones, they don't have tumor markers.
No, none.
So I send them a request for having these done. Then once all the results are in, we schedule a consult, we expose and explain all the things that are happening to this patient. And then that's the time I recommend
the BHRT.
number one, a lifestyle change, of course.
Okay, lifestyle. Not medicine pa.
Yeah, lifestyle change, supplements, and then, of course, BHRT, which is usually deficient or imbalanced in these
And then,
patients.
what if they're like, you see them that they're like a heart attack going to happen? Of course, you're going to ask them to go to a cardiologist. No.
There are cardiologists who understand what we do with hormones, and I refer to them. So they request for a 2D echo, a stress 2D, stress echo. They request for a 24-hour Holter for rhythm. They request for a 24-hour blood pressure monitoring. So once the results of these are done and they come out, we again interpret them in relation to their other test results. So I am working with functional cardiologists, functional endocrinologists, OBGYNs even. Well, since most of these patients come to us wanting to look younger, I end up referring them to
Plastic surgeon.
aesthetic medicine.
Exactly. Kasi
specialists,
I wanted pala to ask you, most of the common people know when you talk about anti-aging, it's always cosmetic. It's always plastic surgeons. It's about applying creams or the dermas, Botox. But you're internal, you're regenerative.
Well, I'm both or everything. But I always believe that the good appearance comes from good health within. So you correct the health and the appearance follows.
But I'm sure people are appearance first, then inside after.
Well, you did mention that menopausal women have their skins deteriorating, sagging.
Yeah,
It's
and then
actually,
me, melasma.
Yes,
I think the sun, I'm more sensitive to the sun and I get this dark melasma.
patches, yes.
Is that hormones?
These things happen even when you were younger. But your body was much more capable of repairing these insults from the environment back when you were younger. Now they lag behind. So it's always a balance or a race between degeneration and regeneration. Melasma, for one, is a degenerative change. Skin wrinkles, sagging, they are degenerative changes.
Which are hormonal.
Yes, everything is hormonal, yes. So your body's regenerative capacity cannot keep up anymore. So that's when you start correcting your hormones. Because it's actually the hormones that causes your body to lag behind the regeneration.
So if I do take BHRT, my melasma will lessen or disappear.
Will improve. Yes, it can lessen. It can totally disappear.
Wow.
But your regenerative capacity, your body's ability to regenerate, will go back to maybe 10, 20 years younger. Yes. Because when we do BHRT, and this is very important, we don't bring you back to menstruation.
No, I wouldn't want to.
I'm sure.
Diba?
Menstruation is a function of reproducing or reproductive phase of a human's life. But your hormones also are, like I said, responsible for a lot of other functions of the body. In fact, all the functions in the body. So we only top up your hormones to a functional level.
Not to childbearing stage.
Not to reproductive age. Yeah. We're not Abraham and Sarah.
Okay. Pero pwede oo nga. Okay. Personal question, Doc.
Yes.
You could have stayed in the US. I know you practice in the US. Kanina, you said that. Why stay in the Philippines again?
Well,
Is it love?
No. Well, number one, I really did not want to migrate, much to my father's disappointment. Second, before leaving, I knew there was what we call brain drain during those times.
Okay.
Meaning most of our professionals are going abroad and leaving us with a lack or a deficiency of doctors, particularly in the far-flung areas. So not that I wanted to go to the far-flung areas, but I did, of course, one phase of my life. I wanted to not not to make that condition worse. So I did not want to practice elsewhere except in the Philippines.
Oh, wow. So you really sought your calling. Feeling ko calling yun eh. Kasi if you're want to stay here and you have a definite want or desire to help the Filipinos.
Choosing to be a doctor is a calling.
Okay. Choosing to be here is a
choice. So wherever you are, doctors are usually called to service. But I knew that there was a need for doctors in the Philippines. So I wouldn't want to make that situation worse.
Wow. And it's so hard to find doctors that are willing to go out of the box. Like personally, my lipid panels were so high, my LDL was high, and I went to a doctor. Then they just say, here's a statin. But I didn't want to because I didn't feel that statin was the answer. So I told the doctor, I'll first do lifestyle changes. But it's still high. And so that's why I went now to a functional doctor because I don't eat this. I lowered my carbs, but my LDL levels were still high. So I was thinking it might be hormonal.
Okay, even the cardiologists will admit that they have more difficulty controlling a patient's cholesterol if the patient is 60, 65 and above.
Oh, see, so it's not the answer. It's not statin.
Yes, because the reason why we talked about ranges, so we treat patients with statins because their cholesterol is beyond the range. But like I said, these ranges are the least of our concerns because if you look at laboratory results, these ranges are the same practically from a teenage to an elderly.
Okay.
Which is not logical because the requirements and changes in the body happen as we age. So there must be a difference. So the difference lies in the fact that the basic molecule for production of hormones is cholesterol.
And we need it, right, for our brain?
Well, yes. As we age, we need more and more cholesterol. In fact, I don't even want to use a terminology bad and good cholesterol because bad cholesterol, which is LDL and triglycerides, we also need that in the body, particularly for repair. Our cell membrane is lipids. And we repair on a daily basis. So if you suppress lipid metabolism, then you suppress healing. So the reason why we have higher cholesterol levels in the elderly
because there's so much inflammation.
No, because they need cholesterol to produce more hormones and to heal more. The older you get, the more healing you need.
Okay.
So this thing about the elderly not needing to sleep anymore, the more they need sleep because it's in sleep we heal the body. So they don't sleep as much because their melatonin, together with all the other hormones, they decrease also. Melatonin is a hormone secreted by the brain. We call them neurotransmitters. So hormones produced in the brain are called neurotransmitters. Melatonin, one of them, declines with it. Human growth hormone declines with it. And these two we need for detoxification and regeneration.
So again, that's why we need, buti na lang you're here in the Philippines or else it's so hard to find a doctor that can answer all these questions because we go to a specialist and they just do this. But with your practice, and I think you have a lot of doctors with you, functional doctors, that treat the body as a whole.
There are a lot more doctors now practicing this way. So all you have to do is tell your doctor what you want, what your goals are, what you're experiencing, and your doctor will sort this out more than we used to in the past. It's just a basic understanding or going back to basics like physiology and biochemistry. So there's no witchcraft here, there's no magic. It's just going back to basics.
I remember the olden times, there's only one doctor and it's just a general practitioner who does everything.
Yes.
Right? So,
actually, I have a mentor who's very influential with my wanting to practice like the old doctors that You tell me you have cough and colds, and I treat your cough and colds. And then I find out that you have cough and colds every month, and we start digging, and we correct that cause. That's how doctors used to be in the past.
Yeah, then they do house calls before.
Well, they do house calls, they treat the sick person, and then they treat all the other members of the family on a preventive stance.
Galing nga eh. So, thank you, Doc. We're about to end. And I hope I can fix the sound. To everyone, every woman listening, you know, our bodies are sacred. They're not betraying us. They just need balance. And hormone
Sorry, we are
replacement.
actually betraying our bodies.
Oh, why? What do you mean?
We shortened our lifestyle. We shortened our lifespan because of our lifestyle. What we do now.
But it's not the body betraying.
It's not the body betraying us. It's us betraying our bodies. Our bodies were perfectly designed to regenerate and heal itself.
And that's why we have to take this BHRT to help our bodies also heal themselves.
Well, I always practice. My practice is always based on 3 foundations. One is good diet, regular exercise, and supplementation or proper supplementation. And that proper supplementation does not stop with vitamins. It also entails minerals and hormones. Like I always said during our talk, we top up your hormones. It's like supplementing your...
So it's like vitamins na rin, no?
I wouldn't go that far. Hormones are
It's
hormones.
like the cream.
Yeah.
So wait, the BHRT is a cream, not injectable. I can...
BHRT encompasses a lot of forms or SKUs. There's cream, there's injectables, there are even pellets that you implant. Remember
or
when...
a sticker, like a nicotine patch.
that too is a topical form, yes. There are also sublingual ones. Okay, sublingual supplements are dropped or applied under the tongue where the blood circulation is more or better. So they get absorbed into the blood rather than swallowed into the liver. So BHRT encompasses a lot of different forms.
So how will the people, the listeners, or the people who are viewing get in touch with you, Doc? I can put it also in the show notes, but
Better
for
that
now...
way. I don't want to advertise.
Okay, wait, Next Century?
No,
What's the
it's my clinic is in Centuria, Medical Makati.
Okay, and what's it called?
The Next Step.
The Next Step. I think Next Century in
The
Centuria.
clinic's name is The Next
No, mali.
Step. Yeah.
Again, it is The Next Step, and it's in Centuria Hospital.
Centuria Medical Makati.
Centuria Medical Makati, and Dr. Ben Valdecañas is the expert he's an expert orthopedic surgeon. He's a regenerative doctor, a functional doctor, and many more. I'll put it all in the show notes. So thank you for listening. And you're listening to Be.Live, be yourself and live your purpose. I'm Roca Cruz with Dr. Ben Valdecañas. Thank you for listening.
Thank you.
This episode of Be.Live, be yourself and live your purpose was recorded at Los Tacos BGC. Thank you so much. Special thanks to Dr. Ben Valdecañas of the Next Step Center for Regenerative and Reconstructive Medicine at Centuria Medical Makati. You can reach him at 0917-124-8884 or email him at thenextstepmd@gmail.com.